At the Children and Youth in Challenging Contexts Network, we are mapping best practices for improving the mental health and well-being of vulnerable young people in Canada and around the world. Two of the learnings that show up again and again in our work are the importance of collaboration across systems and engaging young people. We integrate that in everything we do. A vulnerable young person might interact with a number of systems: mental health, juvenile justice, education, and child welfare. We've learned that the best outcomes are generated when there is collaboration and communication between all of those systems, young people, and their families. That's why we integrate the discoveries of leading researchers with the real-world experiences of local service providers, policymakers, and most importantly, young people. Meaningfully collaborating with youth is not only important, it's essential. Youth are the real experts on what works best for them. In our network, young people are involved in decision-making at every level. They are members of our governing board, and they help guide our research and facilitate public events. Using a collaborative approach that engages youth, we've explored a number of key issues to identify how we can improve the lives of vulnerable young people. Here are some of the things we've learned. There's an urgent need to find mental health interventions that are accessible to youth that have witnessed or experienced violence. While many traditional approaches treat youth solely as victims, an approach that shows much more promise is nurturing the young person's skills and strengths. Through our work with partners like the Canadian Red Cross and the Dallaire Child Soldiers Initiative, we've learned that if violence during emergencies can be predicted, it can be prevented. States and organizations can plan to protect children from violence just like they plan to evacuate people from danger zones. We've explored how technology can be a valuable tool for vulnerable young people. It works best when it's designed and implemented in collaboration with youth themselves. For example, the organization Mind Your Mind designs all of their web tools, blogs, games, apps, and their website with young people to help them manage and support their own mental well-being. Everyone knows about the social stigma around mental health issues, but when we asked how youth are accessing information on mental health, we learned that self-stigma prevents youth from acknowledging their own mental health issues and inhibits them from searching for information that can help. We uncovered a major need for programming that educates youth on their mental health, but we also discovered programs that are working, like Langhouse in Halifax, that uses youth engagement to battle stigma through art, peer groups, and other activities. Research is critical for understanding the experiences of vulnerable young people. But we've learned the traditional ethics approval process creates a barrier for researchers trying to learn from those experiences. Minors often require parental consent or are told to hang on to a consent form, which may actually increase their vulnerability in their homes or communities. At the CYCC Network, we've been busy working to identify best practices for improving the lives of vulnerable young people. And there's plenty more work to do. You can see all we've done on our website, including videos, reports, policy checklists, and other resources that can help anyone working with children and youth in challenging contexts.